Hello everyone, in this video we'll be seeing last minute revision points in psychiatry and skin. Drug of choice for rapid cycling MDP is sodium valproate. FDA approved management of refractory depression, combination of fluoxetine with olanzapine. Commonest psychiatric illness in India is endogenous depression. Early morning awakening is seen characteristically in endogenous depression. Common cause of mood congruent delusions is depression. The neurotransmitter defect implicated in depression is catecholamines. The characteristic feature of mania is high self-esteem. Dysthymia is mild chronic depressed mood. Alexithymia is inability to express emotions. This is important. The most common psychiatric complication of chronic antihypertensive therapy is depression. Drug of choice of acute anxiety attack is benzodiazepine. Drug of choice in GAD is benzodiazepines or SSRIs or TCS or buspirone. GAD is generalized anxiety disorder. Agoraphobia is fear of spaces from where easy escape is not possible. This is important. Study of phobias. Most common type of phobia is agoraphobia. Flooding is a type of behavior therapy used in the treatment of phobia. This is important. More specific symptoms of social phobia is blushing and shaking. No or minimum complaints are taken as sign of deadly disease. Body dysmorphic disorder. In hysteria, defensive mechanism is dissociation. This is important. What they will ask, what is the defensive mechanism in hysteria? The hysterical seizures never occur in sleep. The treatment of choice in hysteria is psychotherapy. Feature of anarchistic personality disorder is rigidity and stubbornness. The personality with traits like discipline, parsimonious, punctuality, liking cleanliness, etc. is anarchistic. Dramatic, emotionally suggestibility and over-concern with physical attractiveness is a feature of personality trait. Histrionic personality. Personality disorders is more common in females is histrionic. Body image disorder is anorexia nervosa. Anorexia nervosa can be differentiated from bulimia nervosa by intense fear of weight gain. Amenorrhea is seen in anorexia nervosa. Binge eating followed by forceful eating and purging with a laxative is seen in bulimia nervosa. This is very important. Cognitive cognitive theory of depression is given by Beck. This is important. ECT is contraindicated in acute anxiety. Free association is a patient revealing his thoughts freely to a therapist. Counter-transference means feeling therapist develops toward patient during psychotherapy. Displacement is a defensive mechanism in phobia. They'll ask what is the defensive mechanism in phobia. Displacement, this is important. Primary processes as per Freud is non-logical and primitive. Undoing is a defense mechanism in OCD. Habit reversal training is a therapy for trichotillomania. Regression and fixation in OCD as per Freud model is at an anal stage of psychosexual development. Imbecile is a moderate mental retardation with IQ of 35 to 49. In severe mental retardation, IQ is 20 to 35. Treatable cause of mental retardation is hypothyroidism. Autism is a disorder of development. Autism is social and language communication problem. Asperger's syndrome is a developmental disorder. Cicatricial alopecia is seen in discoid lupus erythematosus DLE. Nail involvement is not a feature of DLE. Moth-eaten appearance is seen in secondary syphilis. This is important. Donovanosis is caused by Campylobacterium granulomatis. For lymphogranuloma venereum, the drug of choice is doxycycline, LGV. Granular IgA deposit at dermal papilla found in dermatitis herpetiformis. This is important. Intercellular IgG deposition in epidermis is seen in pemphigus. Persistent painful oral regions with acantholytic cells are seen in pemphigus vulgaris. This is important. Intraepidermal blisters are seen in pemphigus foliaceus. Leprosy does not affect ovaries. The most effective drug against Mycobacterium leprae is rifampicin. Maximum suppression of cell-mediated immunity occurs in lepromatous leprosy. Negative smear is seen in neuritic type of leprosy. Half-life of dapsone is 24 hours. Parapsoriasis can progress to which malignancy? Can progress to cutaneous T-cell lymphoma. Leonine phases are seen in LL type of leprosy. Nail involvement is not a feature of DLE. Underlying internal malignancy is not seen in and shown by granuloma annulare. Rose spots are seen in typhoid. Palpable purpura is not seen in idiopathic thrombocytopenic purpura. Features of hereditary angioedema. Autosomal dominant inheritance. The most frequent cause of Lyell's disease is drug induced. This is important MCQ. Hailey-Hailey disease is inherited as autosomal dominant. Ichthyosis vulgaris is inherited as autosomal dominant. Etiology of epidermolysis bullosa is genetic. Leash nodules are seen in neurofibromatosis. Pruritus is not seen in pemphigus. Medically important form of UV radiation is UVB. This is very important MCQ. Neonatal fat necrosis resembles post-steroidal panniculitis. In Sweet syndrome, neutrophilia is present. This is important. Crocodile skin or sauroderma is seen in Ichthyosis vulgaris. This is frequently asked MCQ. Facial telangiectatic erythema, photosensitivity and dwarfism are seen in Bloom's disease. Chemical peeling is done by trichloroacetic acid. This is important. Steroid most potent as ointment. A red color to tattoos is produced by the pigment mercuric sulfide. An autoimmune pathology is seen in pemphigus vulgaris. The rash in measles occurs first in the post-auricular region. This is the most important MCQ. A nevus present at birth, which has predisposition to the development of malignant melanoma, is giant congenital pigmented nevus. Coming to Kasabach-Merritt syndrome, it represents hemangiomas with thrombocytopenia. This is important. The most common pre-malignant tumor of skin is actinic keratosis. Nevus of melanocytes Baker nevus. Maximum malignant potential is seen in junctional nevus. Predisposing factors for skin cancer is UV light. Changes of squamous cell carcinoma seen in Bowen's disease. Actinic keratosis is seen in squamous cell carcinoma. Actinic keratosis is associated with sun exposure. Coming to mycosis fungoides, mostly affects T cells. This is an important MCQ. Portreous microabscess is a histological feature of mycosis fungoides. Total skin electron irradiation is used for treatment of mycosis fungoides. Skin tag are not pre-malignant. Delusion is not present in compulsive disorders. Formed visual hallucinations are seen in lesions of temporal lobe. Drug of choice of acute anxiety attack is benzodiazepine. Drug of choice of generalized anxiety disorder is benzodiazepines or SSRIs or TCS or buspirone. Most common cause of dementia is Alzheimer's disease. Rorschach's test measures personality. This is the most important test. Thank you for watching this video. For more videos, subscribe to my channel.